I'm going to be showing you hamstring massage today. Normally, if I was doing a full leg treatment, I might choose to have my client supine or prone to start with. It doesn't really make too much difference. For today, I'm just showing you all the techniques I could do on a hamstring, and then you could revise that and practice on the other leg. But I would start with a hamstring, move down to a calf, move to the Achilles, and finish with the full leg. So as a form of routine or procedure, you could do that. For today, I'm just going to show you the hamstring techniques. So we'll expose the top of the hamstring here. Depending on what the client has chosen to wear for the treatment, some people will come in shorts, but if they're thick rugby shorts, they're actually really hard to go any higher than this point, and therefore you're only massaging half a hamstring. So I tend to ask if they are wearing underwear, which I hope they are, is to then pull right up to here. So everything's covered and draped, but we can get right to that insertion point at the top. So make sure you are doing the full length of the hamstring. So I'm going to apply the lotion to start with. I'm using a Naki Sports Massage Lotion today. Warm it up in your hands before you apply it on. And then work right up into where you've tucked the towels in. Just need a touch more. Okay, so we've got the foot up on the bolster. That partially flexes the leg there just to take the pressure off. And I'm going to start with in a lunging stance on the hamstring with Effleurage technique. So we can call it a longitudinal effleurage, where we're working right to the top, and my hands will go towards the outside here to the greater trochanter. We don't want any hands going to the inside of the leg. So we're going up to the outside and coming down, getting both sides of the thigh. People always ask how many techniques to do to warm up, but there isn't a definite answer. It's until you start to feel the muscle warming up and you're going to change to the next technique. We've got a lot of techniques that involve warming up, and it is really important to get that muscle warm before we move to any deeper techniques. The more relaxed the client is, the more pressure they'll actually take. So if your view on sports massage is causing pain and getting elbows in there to get as deep as possible, I think you need to really change what you're doing. The more relaxed the client is and the more comfortable they are with you, then the deeper you can go, and it will be more manageable as well. So we're going to go reinforced effleurage, straight elbows, lean your body weight on. Got quite a low couch today. A lot of therapists use couches which are a bit high, and therefore they're not applying their body weight properly. So even if you are massaging a large muscular client and you might be small framed, 5 foot tall, you can still get the amount of pressure with your body weight and the correct couch height. It's not about strength, it's about how efficiently you use your body weight and techniques. So we've got a reinforced effleurage. As you can see, when I'm talking, I'm just doing a bit of everything. So techniques are going from one thing to another. You keep working, keep the muscles getting warm, keep flowing and linking them all together. So I could move on to a technique which I call crisscross lifting. It's a form of Petrissage. So we're lifting the hamstrings up rather than on the back. If you watch the back video, the lumbar video, we went across and our pressure stroke went out. This pressure stroke is coming up. We'll lift up the hamstrings. When techniques become a bit more manipulation, mobilizing, they're called Petrissage. Okay, when it's on the surface, more superficial, it's an effleurage technique. So we're now lifting up, go right to the outside. I'm just going to apply a little bit more lotion. And we're going to move to a kneading technique. So kneading is with your thumbs and your fingers. And all the time when we're doing massage, we're assessing assessing the muscle tone, assessing the skin, how much they're absorbing the lotion. Are any areas particularly tight? You can see I'm coming round here, so I'm getting a bit of the adductors in. I'm going to do a video on quads and adductors. So even by doing hamstring, we are warming up the inside of the leg, what people might term the groin area. And then from the outside, if you can see around the corner here, I'm getting my thumbs in to part of the quad called the vastus lateralis, and you can see this indentation here. So that's the IT band. We will talk about the IT band when we do the quad video, because it's quite controversial, shall I say, in terms of how effective massage treatments are. But still, working around this area, we're getting the lateral quads. So with our kneading techniques, we can move to a technique called palmar kneading. So we pick up, squeeze down, pick up, squeeze down. You can go this side. You can do them together. So just make sure you are doing the full length of the muscles. There are just 3 muscles that make up the hamstring on the back of the leg. So I'll just point those out if you're trying to learn anatomy as you're learning massage as well. There's a little point here, right on the fold of the glute. If you press in there, it's called the ischial tuberosity, part of the ischium, which is this round-shaped bone on the pelvis. So all 3 hamstrings attach onto the ischium, or ischial tuberosity. And then one big hamstring, it fills the whole outside of the lateral thigh to here. And if we bend the leg, you will be able to see this tendon here, which attaches onto the head of the fibula. So that's the bicep femoris. It's probably the biggest, most powerful muscle of the hamstring. On the inside, from this point here, called the ischial tuberosity, we've got 2 muscles, semimembranosus and tendinosus. Semimembranosus is underneath, and it will attach onto this posterior tibia. And the semitendinosus comes from here, lies on top, comes around. You will find it as a skinny little tendon on the inside of the knee, and it comes around to a point called the pes anserinus on the front. So 2 muscles on the medial hamstring, 2 semis, and bicep femoris on the outside. And from experience, if people are to pull a hamstring, it tends to be this outside bicep femoris. A lot of people as well struggle with high hamstring tendinopathy from up here, so their tendon will start to degenerate, or they'll pull the tendon right at the top. So that's why it's important to be able to work on the whole area. So I'm just moving now to Effleurage du poids. If I'm teaching it in class, I will teach it quite structured, and we'll work up to the top. As I'm talking, you can see I'm just using both hands, but I'm using the fist. So Effleurage du poids means to stroke with the fist. And you can go deeper if you want to. You can lean more body weight on. See a little bit of a tense there. I've talked in previous videos about how deep to work. So if we're trying to see the level of depth of pressure we're using and how much a client can take, it is very subjective. So I can use a pain scale or pressure scale of 1 to 10. 1 you can't feel, 10 is unbearable, and an 8 is an acceptable, I can cope with it, but it actually feels like it's doing good. That's what I would call an 8 out of 10. The question not to ask would be, is it okay? Because our polite clients would always answer yes. So we can change that question to, can I go a bit deeper? And that will give you different responses, and we'll let you know if you can put a bit more pressure on. So I'm now changing to forearm effleurage. Again, let's go, but you don't want to start underneath the knee and put deep pressure on the back of the knee. It's the popliteal area. So let's start just above here, and I'm going to lean on. I'm going to use a good posture, put my body weight down through my elbow, and go right up to that ischial tuberosity at the top. So I can have both hands here, one hand on the client. So that's more of a forearm effleurage, and being able to use both, being ambidextrous as a therapist, you really need to start doing. Don't rely on one side or your strongest side. They both need to be strong. Sorry, Martin. That was an 8 or 9 out of 10, that one. So look for body responses as you are working. Another technique we can use here is a technique called lengthening. So with lengthening, 3 steps. The first step is to shorten the muscle. Then we get the client to move as we apply pressure up. So for the hamstring, let's shorten. Let me do it. That's it. So the hamstring's nice and relaxed. If your client tries to do it, they'll end up cramping because their muscles are in a shortened position here. So nice and relaxed. I'm going to use my fist, and as I lower the leg with gravity, I'm just working slowly up from the back of the knee, the popliteal area, right up to, what's that bony bit? Where do the hamstrings attach? Okay, I'm hoping you said ischial tuberosity. So give yourself a point there. But we go right up to the top, straight elbow, straight wrist. So we're getting the client to move, or we're assisting movement. You can do it with a fist if you want to. We can do it with a forearm. Okay, and soothe off. Just re-tuck those in. We can also do a technique called compression. And compression, I compare to squeezing a bath sponge. So if you fill a bath sponge, put it in the bath and it's full of water, as you squeeze it, all the water will rush out the sponge, and as you release it, it will then reabsorb and fill up again. So we think of the hamstring, we're going to go right in the middle, put one hand on the other hand, and then slowly sink into the hamstring. Okay, deep as you can, hold for 5, and then relax. So similar to that bath sponge, squeezing out the blood as you relax. Hopefully it will reflush. So it's a good way of stretching, but also flushing out. And it feels quite nice as well. That's called compression. So we're doing compression with the heel of the hand. We can do compressions that are more specific. So if there's a particular part of the hamstring you think with your palpation skills is particularly tight, you can do a more specific compression technique, more pinpoint. So I can use the thumb there and press in, or save your thumbs, go with an elbow. As I go in with my elbow, we can ask our client what we're rating out of 10. And once you get to a 7 or 8, which is quite uncomfortable, you can hold it there. You can get your client to breathe through it. I normally say 3 deep breaths. And throughout their breathing, then the pressure scale of 8 feels like it's reducing. So hopefully it's reducing down to 6, 5, 4, and take the pressure off. So we do that technique on tight areas, or what we might know as trigger points in the body. And then always go over with Effleurage just to soothe off. I'm going back now to Effleurage techniques and some Petrissage or kneading. We've done lengthening on it. As I said earlier, I'd like to combine that with a full leg treatment, especially if this was a runner, and I'd work down to the Achilles. So for this video, I'm just going to finish the hamstring there, but I want you to practice that on the other leg, see if you can remember the techniques and try and get everything flowing nicely. So my last technique, and it is important that techniques go up towards the body, my Effleurage reinforced effleurage. And how are we going to finish this so the client knows we've finished, apart from telling them how much they owe you. Okay, so my finishing technique here would be a compression. I would cover the leg back up. Okay, and then just remove a bit of the lotion, a little bit of rocking. This was a full leg treatment. I can go right down to the calf. Okay, and I would finish there.